Every day we communicate through words, we read books, write messages, and engage in conversations. Yet, some of the most meaningful human experiences are expressed without a single word.
Mind is not an organ. But we speak of mind. We speak of mental health. If Ramayana, you remember when Ram in his travel to south to Sri Lanka came across Bali and Sugriv and this kingdom of monkeys, and they were very powerful, everything. The fun of it is they spoke to each other with words, but they do not look alike. Only Ram looked like current human being, as given in our pictures. An excited patient comes. Generally, when it came to Sasun OPD, he was not alone. He was brought with hand tied by some relatives or neighbors. And कसं तीन चार लोक धरून they used to bring him inside. And I suddenly see an excited patient with 4 people. My usual trick, which came from acting, is to shout at those who are held in power.
Good evening, everyone. Namaskar and a warm welcome to all. It gives us immense pleasure to welcome you to another insightful episode of IPS Podcast, where Psychiatry speaks, an initiative of Indian Psychiatric Society. Every day we communicate through words, we read books, write messages, and engage in conversations. Yet, some of the most meaningful human experiences are expressed without a single word. A smile can reassure, silence can comfort, a glance can convey affection, and a pause can reveal emotions that language often cannot. The mind has its own language, one that is spoken through expressions, gestures, stories, music, theater, and cinema. Long before we learn to read and write, we begin to understand this language. It shapes our emotions, nurtures empathy, influences our relationships, and quietly contributes to who we become. In today's world, while literacy has become nearly universal, emotional literacy remains an often overlooked aspect of human development. Perhaps some of life's most profound lessons are learned not only from textbooks, but from the stories we read, the characters we admire, the plays we witness, and the films that move us. Today, we explore this fascinating intersection of psychiatry, literature, theater, cinema through the theme Language of the Mind. And who better to guide us on this journey than someone who has spent a lifetime understanding the human mind from two extraordinary perspectives, that of a psychiatrist and that of a performer. It is our great privilege and honor to welcome Padmashri Dr. Mohan Agase, an eminent psychiatrist, one of India's most distinguished actors, recipient of prestigious Sangeet Natak Academy Award and numerous other national and international honors. Through his remarkable contributions to psychiatry, theater, cinema, and public life, Dr. Agase has demonstrated that understanding human emotion is as much as an art as it is a science. Sir, it is a privilege to have you with us today. On behalf of Indian Psychiatric Society and IPS Podcast Task Force, I extend a very warm welcome to you.
Thank you. Thank you very much.
Before we begin today's conversation, I would like to invite our esteemed IPS leadership to share a few words with our audience and us. So it is my privilege to first invite Dr. TSS Rao, sir, Honorable President of Indian Psychiatric Society, to kindly address us.
Good evening, all. Dr. Mohan Agase, sir, and all the esteemed members who are there in this program. I'm extremely delighted, and is one of the classic example. An idea once planted can grow, and far beyond it can influence many people in many ways. This is one of the classic example. And it also says that if you choose people properly, how an idea can grow so well and so positively. And I congratulate Archana and her team for keeping this particular flag flying high, and it has become almost regularly meeting so many people, both young and old. And coming to this today's program, if I can remember very well, as a postgraduate student, we used to look at some people down south, somewhere in the west, somewhere in the north. Each zone had at least about 2, 3 people whom we used to look forward to. And one of such name is actually Dr. Mohan Agase. And I had occasion to talk to him, learn something, and more than anything else, interacting with one of the nicest human beings is actually what I can recollect. And I'm really fortunate that what I had dreamt as a PG, maybe an young individual, today I'm sharing the stage with Dr. Mohan Agase. That speaks volumes about how lucky I am. Sir, I won't want to waste my time because everybody knows about you, and we are all well aware how inspiring it could be. Thank you so much, and all the best wishes for the program.
Thank you very much, sir, for your inspiring words and your constant encouragement to our initiative. May I now request Dr. O.P. Singh, sir, Vice President, cum President-elect of Indian Psychiatric Society, should share his thoughts.
Good evening, everybody. I welcome Sir Padmashri Mohan Agase, sir, and all the people who have joined, all seniors and also juniors and all the dignitaries who have joined, and our colleagues. So this committee is doing great work. And of course, the topic is also very interesting, language of mind. So it's to express our thoughts even without saying. So we are going to learn, and we are eager to listen to Padmashri Dr. Mohan Agase, sir. So I will not take much time. Thank you. Thank you so much.
Thank you, sir, for your message and for your unwavering support in strengthening this platform for academic dialogue. I now have pleasure of inviting Dr. Arun Narwale, sir, on Regional Secretary of Indian Psychiatric Society, to kindly share a few words with us.
Thank you, Archana. Good evening, everyone. Respected Honorable Dr. Mohan Agase, sir, Padmashri, my mentor, teacher. Then Dr. T.S.S. Rao, sir, our president. VP OP Singh, sir, vice president. Other office bearers, Archana, Dhananjay, George, and Vipul, and other committee members, and all the audience present over here, particularly seniors like Dr. Ajit Bide, Philip Johnson, and from abroad, Dr. Kale. So I will just share some aspects of my teacher. Basically, after right from beginning, MBBS to MD and later during his service, he was more interested in cinemas, drama and cinema. So Gashiram Kotwal was the biggest, drama which actually went abroad also. So that was the first success, and then he never looked back. Uh, he he is actually working still at the age of more than 75, even with overcoming some physical elements also, and still he is enthusiastic. And I have learned this thing from Auragashi sir. Secondly, talking about our team, they are doing fantastic job. I wish them great success in all coming days. So thank you for giving me opportunity to say a few words about the committee and about our today's guest, Dr. Mohan Agashi sir. Thank you.
Thank you, sir, for your valuable insights and experiences about our guests for today and for your dedicated leadership and continuous guidance for us. May I now invite Dr. Lakshmi Naresh Vadlamani, sir, the Honorary Treasurer of IPS, to address our viewers. Has sir joined?
And it's not present.
Sujit is there.
Okay, let's. So we'll take his views later. Finally, it's my honor to invite Dr. Sujit Sakir, sir, Honorary Editor of Indian Journal of Psychiatry, to share his thoughts with us.
Yeah, thank you, Archana, and a big thank you to the entire podcast team. A big my regards to all the office bearers, presidents, sir, vice presidents, sir, general secretary, sir, and Dr. Naresh and others. See, I think there have been many episodes in the podcast, but I think this one is really, really special. And uh, Agashe sir is more of an institution. When we talk about institutions, I think when I had grown up, I had seen him more into films. Our favorite Feluda stories, and he used to be Lal Mohan Ganguly. I still remember the serial. And that was the way I grew up revering him as an actor, apart from the other famous films that Marwale sir talked about. And later on, after joining psychiatry, I realized how phenomenal his contribution has been to the field of psychiatry, especially Maharashtra Mental Health Institute, setting up right from the beginning of psychiatry at Pune and other parts of Maharashtra. It's a real, real privilege, and it will be one of the most precious podcast episodes. I thank you all once again for making me a part of this event, memorable one. Over to you. Thank you once again.
Thank you, sir. Thank you for your thoughtful message to us. And to all our respected office bearers, thank you once again for your inspiring words, your visionary leadership, and your unwavering support to IPS Podcast initiative. And your encouragement motivates us to continue creating meaningful conversations that educate, inspire, and strengthen our psychiatric fraternity. And today's episode will be hosted by me, Dr. Dhananjay, and Dr. George together. So we will begin with our podcast episode now.
Thank you, Archana. Thank you for setting the context. नमस्कार सर, कसे आहात?
मी मस्त आहे.
चालू करतो सर. Sir, not only me, but everyone here is very much curious about why you had selected this thing. The thing, the language of mind. What made you choose this unique thing? Secondly, how should we understand this concept? And why did you think of bringing these two ideas, mind and language, together?
Because everybody wonders now, even in the preliminary discussion, everybody mentioned my participation in theater and films, right?
Yes.
And correctly so. And in fact, I feel that my participation from childhood in theater, films, and interest in literature created my interest in psychology and psychiatry. And that is why eventually, after my undergraduate medical education, I chose psychiatry as the subject of my post-graduation. Now, the reason to choose language of mind is comparatively very simple, but also sometimes confusing. Because I have not yet found anybody giving me a good definition of mind. So, in fact, now let me start with asking you and then Archana, when we utter the word mind, what concept you have? Because mind is not an organ. Brain
Yes,
is
sir.
an organ,
Yes,
but
sir.
mind is not an organ. But we speak of mind, we speak of mental health. And in fact, in current situation, particularly after pandemic corona, more than 50% of people are talking about not only mental health, positive mental health, negative mental health, and everything. And so that is why, since the communication is related to the word mind, how would you, if I am a layperson, and I ask you, sir, please tell me what is mind. So what
So
will
we
you
will
tell me?
so we will give the typical concepts or typical definitions from the book.
So what is that?
Mind is in the brain. There are a lot of compartment like memory, emotions, thinking, and all this in collaboration works. We call it as a mind.
Okay. Archana?
There might be something, all our activities which our brain does about thinking, logics, cognition, and experiences, emotions. All these concepts, what we feel around us, is probably collectively that is how we understand this concept as mind.
May I come in, sir?
Arun, who is the third one today?
Yes, myself, Dr. Arun.
Yes, Arun.
Messenger.
Sir, in simple words, it is the functional capacity of brain.
Absolutely. Not only of brain.
It's more
That's
than that.
incorrect. But
It's more
what
than
I
that.
would say, mind is the function of body because it is not an organ. Second thing, I definitely, my first, brain is no substitute word for mind. Brain at the most is a CPU. But the information which goes to brain is through our sensory apparatus. And these are called gyanendriyas. You are familiar with the word gyanendriya?
Yes, sir.
मराठीत ज्ञानेंद्रिय म्हणतात.
Five
Right.
sensory senses.
Now, unfortunately, brain is not called Gyanendriya. Eyes, ears, tongue, touch, smell, taste, and realization of space, and all these things. These are called Gyanendriyas. In fact, these are our antennas. When we are born and we come out of the mother's womb, we are given these 5 antennas which are underdeveloped. And it takes almost 18 years for a human being to develop. So human is the most lazy animal as far as development is concerned and to become independent. In fact, many human beings are not even independent till they die. Right? I mean, they may not be financially dependent, they may not be dependent intellectually, but many of them can be emotionally dependent, right, in the childhood. So now the reason I came to this conclusion, mind is the function of body, is because though it is true that brain is an organ, but which is not mind because all this information goes to brain. And in modern terminology, at the most, I would consider brain as a central processing unit. Because the brain has to get this information. Right now, also, I know that I'm seeing you, but what I see is your image, and that is not you per se. So, though I can see you, I can't touch you. This is very important to know in real life, right? So, in fact, only after the development of digital technology, we have grown indefinitely in our concept of thinking and communication. Now, after mind, let us come to the word language. What is language? You said beyond words. Word is also a language. It is not that word is not a language. But word has two arms. One is a spoken word and the other is a written word. And if you see the evolution, spoken word came first. Spoken word came from sound. But when the thinking brain, what we call cognitive brain, started developing, and if we go by the evolution theory, that we are probably our ancestors were monkeys. Monkeys at some point of time behaved like human beings, but did not look like human beings. I would like to give you an example which is easily identifiable to every Indian, that of Ramayana. If Ramayana, you remember when Ram in his travel to south, to Sri Lanka, came across Bali and Sugriv and this kingdom of monkeys. And they were very powerful, everything. The fun of it is they spoke to each other with words, but they do not look alike. Only Ram looked like current human being, as given in our pictures, but Bali and Sugriv look like. Now, in fact, I will equate this now that after the digital technology and the virtual reality, there must be changes coming in our own brain. And like we have lost our tail, the next losing entity may not be physical, but may be functional, and that is emotion. Now, when I'm talking, I expect at least one viewer in front of me if I have to speak further. Otherwise, it becomes muttering or talking to self. So, thank you very much.
Yes, sir.
And you can keep on changing, but if all others have gone and only you are remaining, then you have no option but to be in front of me. Because now I can't touch you or anything. At least I can see your smiles, I can see your gestures, I
Yes,
can
sir.
listen to your sounds. Maybe sometimes I would listen to your yawns, or probably you'll go everything. And that is what communication is all about. And it's a tool of communication. So language is basically a tool of communication. And as a human being, we have this herd instinct. We want to communicate with each other. Now, we started communicating right from ancient age. We may not have communicated in words, but we have always communicated not only in expression and body movement, but sometimes in action. Like something you say, I didn't like, I would come and talk. Fortunately, we are on virtual reality, so this won't hurt you. But earlier, but it will communicate my emotion to you. It will not physically harm you, but communicate my emotion. Or if you like something I said and the way you laugh, it makes me happy that look, what I have said, something made you happy. And that's a good, this emotion. But the reason I said that we are likely to lose our next, not bodily element, but functional element is emotion. And why, I will come to that very shortly. But to stick to language, therefore, before the language of word, we have or we are born with some natural languages. And that one first is called body language. As you grow, and when your emotions get more and more sorted out and complicated, from at the birth, even your organs are not sorted out. Do you agree with this?
Yes,
In
sir.
Yes,
fact,
sir.
in the age of 5, which is called the psychosexual development phase 1, all our organs are developing and getting to the right proportion and right functioning. And so if you see that parents are concerned with not whether the child speaks or not initially, but whether he is able to see, whether he is able to hear. And so they do like this. इकडं का वाजवायचं तिकडं वाजवायचं बघताना सुद्धा तू बघतो पण बघतो अगं दिसतं का रे अरे दिस सो पेरेंट्स want to be sure that the organs of communication are developing well much before you learn even to speak or learn to speak mama or papa. Then once this is the first language which we develop. This is the first language we recognize. So if there is a mother and there is another lady, the child will not go to that lady. The child will go to mother. In fact, if the other lady tries to take the child will protest by his simple method, by crying, and when the mother takes, it's okay. So, also, if the child is playing, door opens, and he hears a voice of the mother, he may drop the costliest toy you have given to him and run to the mother. This communication is auditory communication. So that is an auditory language. Third most important language is of touch. And these days, we are very conscious, and it is now included, the good touch and a bad touch, which we are trying to teach children in their young age in order to avoid cases, the result of which is just out today. So, in short, what I mean to say, that we are born with some natural languages which are meant for communication, and simple expression, like positive emotion and negative emotion. As in the stage of developing, we have only positive and negative emotions. And positive emotion is expressed by a simple expression which is common for a young child and an old man. Now you can look at me and see that expression. If the child is happy, the तोंडाचं बोळकं दाखवतो. If old man is happy, he does the same thing. Right? If the child doesn't like anything, if a child, there is a pain, his ear is paining, he doesn't like you, anything which creates a negative feeling in his mind, his expression is Wah! So our primary communications, auditory communications, are expressed only through two very definite features. So mind and a language has a communication from childhood as you are developing till you develop the language of word. And language of word came into existence for what? Why do you think language of word came into existence? Sir.
For communication, sir?
Beg your pardon?
Communications?
But that we were communicating, no? I communicate. I communicate. All right, Archana?
So for better expression of the communication and some basic communications we are doing with words, we can express this better.
More emotion we can express with the words.
Let me put it.
It is trying
all
to.
You all know it, you don't know. See, we are governed by two primary things now as a developed human being. One is thinking, other is emotion. The language of word came when the cognitive brain developed and needed a tool for communicating thoughts. If I want to communicate thought without being aggressive, I can say, I don't think I agree with you. This is communication of thought. I'm very angry with you. You tell it to the child when he goes. So, the language of spoken word communicates both emotion as well as thought. Right? Now, when the brain developed further and our formal education, since it is entirely governed by what is called textbook, probably you might have thought, and probably you know also, how that word must have come textbook. It didn't come as study book. The formal, do you have your textbook of medicine? Do you have your textbook of engineering? Or textbook of your this new technology, digital communication? So, why spoken word communicates both emotion and thought? But when brain developed further, it needed only intellectual communication so that we can have debates. So we can have a profession of justice, which is all unspoken, the way you represent creation through words, right? And that is highly cognitive function. And that cognitive function came from a developed cognitive man who invented written word. Do you agree?
Yes, sir.
And you know, the written word was invented with the help of image. Takta असतो ना आपला. Makatla, A for apple, C for cat. Now C can be for number of cat, camel, kanga, all many words. But for purpose of learning, you say this phonetic of cat is same for camel, is same for king. All right. So the man who developed written word took the help of an image to teach you the written alphabet, like ABCD. And that is why you feel that written languages, like spoken languages, are very different, but spoken languages are many more compared to the written languages. Do you
Yes.
agree? Anybody
Yes.
disagrees here? No.
No, sir.
Yes. Totally. Because written word, if it has to communicate emotion, it has to spend a lot of words, and that too written words. And that cannot be communicated to somebody who can't read, or somebody who can read but doesn't understand from reading, like me. I'm able to read, but I do not necessarily understand the meaning of what I have read. And there are plenty of such people who do not understand the textbook unless a teacher teaches them. And that is why came schools. Otherwise, we would have been enough with libraries. if reading would have been enough for people to develop cognitively, there was no need of school, college. There was definitely no need of a medical teacher. So, in short, what I come to say is the written language, the word textbook was probably, I don't know the etiology, but from my experience, I can say only one thing. Why the study book is not called study book, it's called subtext, is because that book is without any emotional subtext. And that is the reason why you cannot complete to read Gray's Anatomy, part 1, part 2. How many parts are there now? In our time, there were 2.
Who are this?
Yeah. Still there are 2?
Yes.
And these are so huge,
Yes, sir.
right?
Yes.
So do you use it for a pillow? So amongst our listeners, please find out if there is anybody who is successfully read the entire Gray's volume 1 in 1 or 2 days. No. But many of you, have you been able to read a novel of 1,000 pages in 1 day or 2 days?
Yes.
Most of us. Now, objectively, is the same syntax, is the same language, is the same grammar. Yes, the rules of grammar are same, written same, but you can finish the novel. You can't finish a textbook. What is the psychology behind?
Emotions are not there in textbook. Where novel.
Novel is more like life is full of subtext. Life is not a textbook. Yeah.
Yes.
You do use your brain more often for good reasons, but when you become too cognitive, you use it for manipulation also. You know, even in the expression, there are 2 different words. You never call emotional manipulation. You call emotional blackmailing, intellectual manipulation. Intellectual manipulation is more often for selfishness and profit. Emotional blackmailing is more for preserving the relations, and that too emotional relation. Child does emotional blackmailing of parents. Parents also do emotional blackmailing for their children, of their children. Do you agree?
Yes, sir.
There wouldn't be films like Astu. Anyway, so the reason to combine these 2 and choose it as a topic, language of mind is a multilingual communication tool. And of this rich communication tool, the written word from textbook is only used to communicate intellectual thoughts.
Agree.
More often than not. Right?
Thank you, sir.
When you are communicating emotions, verbally it is much easier because verbally you are not only using words. While using words, you are using your sound, you are using your gestures, you are using your body language. And so without saying, even you can communicate. And you have exclamation. Shaila. It's not a word, it's a sound. So there are many sounds you can. But in human life, it is not important 24 hours of the day. You cannot only communicate intellectual thoughts and get the pleasure of living. In fact, you use your intelligence only to make certain decisions in your life. But your day is filled by several decisions you take intuitively. And every moment you are taking some decision or the other. For instance, now you are taking a decision whether to continue with my podcast or leave and put just your photograph and go and eat something. Or that means every now and then we are taking some. Now, after finishing the podcast, you should say, am I hungry? Should I eat now? Or not so hungry, I better sleep. So, lot of decisions are taken with the combination of thinking and gratification. And the gratification is intellectual gratification is not enough for happiness of life. Now, to come, I don't know, am I talking too much? Anyway, you have to ask further questions.
Yes,
so
sir.
let me
Yes.
finish with this. So, in short, what I mean to say that mind being a multilingual function of body, unless we are expert in all these languages, it is not very easy to diagnose our patient, particularly for complicated illness. We have clear-cut disorders of thought as schizophrenias, various types, or delusional disorders, disorders of emotions as mood disorders, then organic disorders, severe disorders, moderate, mild. These are classifications. But basically, more often than not, they're the combination of both or sometimes even three. And that is why I think it is not very useful, or rather, only reading from textbook, particularly about emotions, is not enough. Knowing an emotion from a textbook is, if I have to give you simile, finding a house by Google Map without knowing the road to it. Experiencing an emotion is knowing the way to emotion with the road of it goes. Yeah, that's. And to be a better psychologist, counselor, psychiatrist, you have to know enough also about emotions as you know about intellect. And the Jalashaya of emotion, the sea of emotion, you find in literature, theater, and films, not textbooks.
Thank you, sir. Let me take it forward now. As you are known both as professionally a trained psychiatrist who have studied the same textbook what you had mentioned earlier, and also gone for formal training like us. And at the same time, you have been actively involved in the theater and films. So, is there any connection between these two words?
Yeah, there is a strong connection between the two worlds. And I understood it while doing my undergraduation because in the daytime I was going to the hospital, evening I was spending in the auditorium. What I learned in the hospital is I did not see a single patient who had come only with his body to any ward. Whether it was medicine ward, orthopedic ward, surgical gynec, any ward. Patient always enters the ward or OPD and goes to any doctor with both body and mind. And in order to establish rapport with any patient, if you learn to take care of the emotion of the patient as well as the relatives of the patient, because his illness may be restricted to self, but caretaking is extended to his caregivers. So if I have to remember that when I'm treating a patient, I also have to be careful to involve the relatives, because patient will come to me for 10 minutes. Rest of the time, he is going to spend with his caretakers, right? So if I learn to take care and relax them, नेहमीसारखं यात काही सायकियाट्री पण नाही आहे. कुणी घरी आलं तर आपण काय म्हणतो, उन्हात नालात तो बसा, पाणी घेता का थोडं, ऊन खूप होतं का बाहेर, हां, अगदी नातेवाईक वगैरे असं पुरी गुळ आणि पाणी द्यायचे. हॉस्पिटलमध्ये तर ते देत नाही, पण बोलायचे शब्द, बोलायचं गुळ पाणी काही वापरायला हरकत नाही. आणि आय हॅव यूज दिस इवन टू टॅकल excited psychotic patients. I will just give you one example and we'll finish with this. An excited patient comes, generally when it came to Sasun OPD, he was not alone. He was brought with hand tied by some relatives or neighbors. And कसं बसं 3-4 लोक धरून they used to bring him inside. And I suddenly see an excited patient with 4 people. My usual trick, which came from acting, is to shout at those who had held him out. हा सोडा त्याच्या, कळतं की नाही तुम्हाला, अक्कल माणूस आहे ना तो, सोडा सोडा. The moment they released his hands, he felt comfortable. And whatever he does, I don't understand, what are you suffering? Nothing. Sister, जरा पाणी आणता का थोडं? This cools down the whole thing. You need coolness of the patient, excited patient, at least for a minute and a half till you succeed in giving him injection. And that time there was only Paralleid. There were not much injection. So in short, what I mean to say is, it is very important to learn about emotions, whether you go to specialize in any branch of medicine, because that will come handy to you. Do the survey of general practitioners. More than 40% of the patients get well on their own. And just some good words from the doctor, keep in knowing about family and everything. And that is why it is important to know about emotions. And you come to know about emotions, you come to know about human beings and their emotions much more from literature, film, and plays. Because why? Lot of unconscious is expressed not one-to-one, not when I talk to you, but when I make a poem. Probably I may love somebody, but I don't have guts enough to go and tell her, maybe. But if I do a poem, डोळ्याखाली एक पापणीच्या खाली एकच अश्रू फक्त एक, ढाळलाच तर तुझाच पदर भिजविन. 4 lines like that communicate the emotion much better, and you don't even have to say it. And this is called channelization of emotions. When somebody writes a short story, a poem, draws something, or even the games are positive channelization of emotions. Why do you do boxing? Why you do football? All your aggression, In fact, if you watch carefully and go to the history, those who have played villain in Hindi films, most of them have been thorough gentlemen. From Pran to Amrish Puri to Mohan Agase, of course. Right. Because our all negative emotions have got an outlet. So we don't need to be bad in real life.
Interesting, sir. Interesting.
So to teach, to help our children. So from literature and films, you understand the human being. From medicine and cognitive learning, you learn to analyze it and what needs to be done to change the behavior. Because when there are no complaints of behavior, relatives don't bring the patient or patient don't come. So when they come, they are crossing the border. When they cross the threshold of being so-called normal to little abnormal, they come to psychiatrist. Before that, they go to a theater director or a painter or to somebody else. And there you need the knowledge of how to change his behavior, whether there are some chemical changes, whether he needs some drugs, whether he needs drugs along with counseling, or several other methods of treatment. So the purpose of both is different. Purpose of literature, everything is to understand human being because there are so many. And the purpose of learning medicine and ethically is, if required, how to change his behavior so that patient along with his caregivers both remain happy.
Thank you, sir.
Thank you, sir. So, namaste, sir. I'm Dr. George Reddy, sir.
Yes, George.
So, before I want the viewers to know the nostalgia from Telangana. Our first conference from Telangana, our organizing president, Dr. Yara Sridhar Raju, is a great fan of you.
I had come there. Yeah.
He's also now into acting, producing movies, sir. And it was in 2015, great nostalgia to share with the viewers, sir.
Thank you.
Coming to our podcast, sir. Sir, is psychiatry independent of your life in theatre and films? Or do you believe the two disciplines complement each other? How has each enriched the other?
You are absolutely right. They are like two eyes, two arms, and two. See, the nature has given us why two eyes, 2 ears, 2 legs, to have a balance of life. So it has given us intelligence and emotion. But unfortunately, in formal education, only intelligence is respected. But in real life, we need to respect emotions also. So to achieve that harmony, it is good to know both things.
Sir, little more about your life, how we can take psychiatry and the language of mind for all the youngsters, sir.
Oh, sorry, I didn't get the question.
How psychiatry and the language of mind, what you're talking about, sir.
Yeah.
How would you give the message to the young generation, sir?
Shall I tell you something, not young, old or anything? See, actually, you never advise young generation. You try to learn from them because their perspective of reality is very different from yours. As you become old, you have more memories than dreams. They have more dreams than memories. And in order to be successful, it's better to try to understand them. But I can say one thing for all of us. If we learn to keep our mouth shut and use our eyes, ears, nose better before we open our mouth, we can learn more. And this is taught in our clinical medicine. Inspection, palpation, percussion, auscultation. In fact, you don't even touch the patient for pulse unless you have done these things. You have learned, and these are all sensory systems to learn. Liver, palpating, seeing how the patient can walk. These are all very informative. The moment you open your mouth, your all other centers are closed. So best thing is have some balance between your talk and thought and emotion.
Thank you, sir. I think you rightly said the mind is multilingual. So my next question to you, sir, when you speak about the language of the mind and you are referring to a skill that psychiatrists consciously learn and develop, how does understanding this language shape the way you approach mental health and patient care?
See, whether you are a psychiatrist or not, even a human being, it is always better to understand the other person and respect the other person. So knowing this will help you to understand other human being, and without your knowledge, you will learn empathy. By learning textbook, you will learn only sympathy, not empathy. Empathy is experiential, to have respect for the other. So that is very important.
Dr. Ajit Bide and Philip John want to ask some question, I think.
Sorry?
Dr. Ajit Bide, Dr. Philip John. Ajit?
Thank you, Mohan Dada, for a good expose on.
There is only 1 minute for a question.
Right. So I'll be brief. Thank you for covering that wide canvas of emotion. Interestingly, you started yours, the first part of your lecture, you were telling us that emotion is going to sort of atrophy, if I understood right.
Sorry, say it again.
Emotions are on their way out. Emotions are going to atrophy. Is that what I understood from you in the first part of your talk?
Oh, probably I'm not very clear in hearing. If,
emotions are on.
Can you repeat the question?
You were implying, I thought, in the first part of your talk that emotions are on their way out.
Yes. Yes.
And your
now, it will need another podcast, but quickly to tell you, the whole process is reversed. Before the information explosion, we used to have a lot of experience without knowing about the emotion. See, because the source of information was very limited. It was parents, then the family, then as you go to school, your relatives, school teachers, then you start to learn to read to understand what you read, and then go to library. So by that time you are 17, 18 years old. So you are fully developed. But now you have so much information before you have any experience that your virgin emotional experience has disappeared. You first experience emotions intelligently because you know about it too much. Without knowing whether what you name the emotion is a correct name or a wrong name, that needs experience. And that is why you see now, I shouldn't tell you, if you see the young generation's approach, or William Holden once said, what used to be normal emotion, young generation calls it sentiment. Don't be sentimental. I had another script the other day, and the script is about a lady doing PhD on it. She says, why do you depend on your children? Is there any animal which is dependent on their offsprings? So why you should be dependent on your children? I told her that, my dear, because your children are long dependent on you. So it's a circular motion. In your old age, you have to be dependent on them. And they have to know it while growing up. Otherwise, you chuck them out the moment they start walking. Then look after yourself. Complicated issue, but worth thinking about.
Thank you.
Thank you, sir. Thank you for inviting me and listening to me.
Philip John wants to ask some question, I think.
No, I was about to make a comment. It is about this.
Yeah.
Mohan, all through this, you have actually made a remarkable integration of this concept of body language, mind, and then the neurophysiology of what is happening. When the child develops, the pruning that happens, and the neurobiological features that develop. And then you also spoke about something like dyslexia, which are neurodevelopmental disorders, which actually are a function, a dysfunction that arises out of the difficulties that we have during these phases of development. So it is very wonderfully integrated.
Thank you. Thank you.
It is. I spent an evening of great learning, Mohan, after a long number of years after while we met in Nimads. Thank you very much.
Thank you. Thank you. Thank you, everybody.
Thank you, sir. Thank you.
Thank you,
What an
Archana.
amazing conversation it was, sir. And before we leave you, sir, our audience would like to know a little about you. One important thing which we all want to know is, sir, how have you balanced these two equally demanding yet deeply interconnected worlds of psychiatry and
It's
performing and
exactly
acting?
the nature's gift. How you balance standing on two legs. The advantage is you can stand on one leg for some time and explore the world with the other. Then change the leg and explore the other world with other leg. So one thing is doing consciously examining a patient, unconsciously you are trying to solve some issue in the theater. And while you are acting, suddenly there is a light, oh, that patient must be unipolar mania. Something like that. We work like that, consciously and subconsciously and unconsciously, all the time.
Great, sir. Thank you, sir. Thank you for giving us this time. And on behalf of Indian Psychiatric Society and IPS Podcast Task Force, I sincerely thank you for sharing your wisdom and remarkable journey with us.
Thank you.
It was an absolute privilege to host you, sir.
Thank you.
Yeah, feeling great.
Thank you.
Thank you very much, sir.
Bye-bye.
Anuya, Piyali.
Really kindly
Yes.
propose a formal vote of thanks.
Thank you, Dr. Archana. Good evening, everyone. As we bring this extraordinary episode of the IPS podcast to a close, my heart is filled with immense gratitude. Today, we witnessed a masterclass in decoding human behavior. Our theme, the language of mind, found its perfect translator in our guest today, a man who carries a stethoscope in one hand and neurasers in other. A heartfelt thank you to the living legend, Padmashri Dr. Mohan Agase, sir. Sir, you spent a lifetime reminding us that the psychiatric OPD and the theatre stage are not two different worlds. Both are profound schools of human emotion. Today, you beautifully broke down how cinema captures the unspoken, fractured scripts of our minds. If I'm not wrong, then one of your movie named Kasawa, you gracefully held a mirror to clinical depression, teaching us that healing like a turtle's journey requires a safe cell and a patient space. Thank you, sir, for showing us that while psychiatry provides the diagnosis, art provides the expression. Thank you very much, sir. On behalf of IPS Podcast team, we express our gratitude to our respected President, Dr. DSS Rao, sir, respected Vice President cum President-elect Dr. O.P. Singh, sir, Honorary Secretary Dr. Arun Marwale, sir, Honorary Editor Dr. Sujit Sakhar, sir, Honorary Treasurer Dr. Naresh Vadlavani, sir, for their continuous support and vision in creating platform like this podcast. And special thanks to our wonderful audience, Dr. Ajit Vire, Dr. Dilip Kumar Patel, Dr. Rajsekhar, Dr. Avay Matkar, Dr. Harihar, Dr. Manika, Dr. Harbardhan, Dr. Sanjeev, Dr. Pramod, Dr. Veena Kapoor, Dr. Ashok Bhagat, Dr. Mukesh, Dr. Jayant, Dr. Avaide, Dr. Philip John, Dr. Vishal, and I may miss many of you. But as we bring the episode to a close, I want to thank the IPS podcast team, Dr. Archana, Dr. Dhananjay, Dr. Judge, Dr. Preeti, Dr. Anua, and good night, everyone. Thank you.
Just before ending,
Thank you so
Piyali,
much.
we are going to have a second episode of Sir's podcast soon or later. It will be on, sir, art and psychiatry, no?
Thank you. Thank you very much.
Thank you. Thank you.
Thank you, sir.